It's Jay. Welcome to Mvskoke Radio, your weekly source for tribal and community news, interesting guests and discussions, plus a local events calendar. Este Stongo Gary Fife Jaho Jeff Giddos, Mvskoke Radio, Mabohedgewedskis. Welcome to our program here on this gray, cool, mulgy morning. We are going to be continuing the coverage of coronavirus situations in our community. I know we're all a little anxious and perhaps fearful, but we want to get the latest information we can and the facts that we can pass on to you in our first segment. So in our second, we'll be talking with Kokulo about the Mvskoke Language Immersion Camp that will be coming up later this summer. But first of all, we'd like to welcome to our studios our Secretary of Health for the Mvskoke Creek Nation, Mr. Sean Terry, and Dr. Billy Beats to our program. Thank you, gentlemen, for making time to come in. We really appreciate it. We are still hearing such a rapid change in things. We've got a situation that you know is in a matter of hours is so different now, and people are getting a little anxious there. And of course, we've seen stories about the panic buying of toilet paper and things like that. I understand that goes to hand sanitizer. Some guy in, Georgia got caught with 17,000 of them and had to give them up. And even read where there's a bit of a run on guns and ammo. People kind of a little leery of what's going on there, but I don't think it's time for that kind of panic or any kind of panic. But first of all, Secretary Terry, I guess let's get a capsule of where we are with the Mvskoke Creek Nation, its preparations here in our community.
Yeah, well, I think that was an extremely good point, Gary, is that it is not a time to panic. Mm-hmm. So first of all, we really need everyone to keep calm through this. We're going to get through this, and we're going to come out on the other side of this. So everyone needs to know that that this will settle down, and we're going to get through this. So I want to take you back just a few weeks and kind of give you a little bit of a timeline on how all of this has progressed and what we have done and what we're doing. So the Department of Health first was alerted to this virus about a month ago, and the first concern that came out was that this virus was leaving China and it was heading across the world, and that there was a shortage of personal protection equipment for healthcare workers, a shortage of surgical masks, a shortage of gowns, and so we began to work with our vendors and our suppliers. We started consolidating all of this equipment for our health system, and so we are currently prepared. We have enough personal protection equipment for our staff, and that we are monitoring those supplies daily to make sure that we're not going to run out, and that was the first thing that happened.
Does the word stockpile fit there?
We stockpiled. We centralized all of our supplies, and so that became very important. So we did that. As the virus started tracking across the world, the Department of Health formulated an internal task force made up of our medical executives, our infection control, safety, quality team. And we started evaluating this situation. As you said, things change almost by the hour. And so we are watching this thing happen in real time, and then we're evaluating what is the impact to the Mvskoke Creek Nation and what do we need to do to either act or react to that situation. So this task force has been happening daily now for a few weeks.
Let me ask you real
okay,
quick.
Go ahead.
Does that meeting kind of supplement like a cabinet meeting with the chief?
No, not yet.
Is it the same?
Not quite.
Okay.
But that is we are this is solely Department of Health employees that's evaluating the epidemiology of this virus.
Mm-hmm.
So that's going on daily. Shortly after that, we started to implement infection control plans. And one of the first things that came out from the CDC was that you needed to be hand washing and sanitizing yourself and your space regularly. So all of our housekeeping and environmental services folks started to train everyone back in what is the right procedures to do that. And we trained all of our facilities to make sure that all of our health facilities had the proper protocols in place to do that. Very shortly after that, Principal Chief Hill asked to begin a task force made up of the cabinet and leadership of the entire tribe. And so our first meeting that we held, we brought in all of the leadership and re-emphasized to them what was the progression of this virus, and once again, what do they need to do to mitigate the risk in their offices and space. And first and foremost was the housekeeping and cleaning procedures. So that took place. And then we started to see the virus hit inside the United States. And like almost every virus that happens, you start seeing it hit on the West Coast and then on the East Coast, and then it starts tracking towards the middle of the country. As it started to find its first couple of cases in Oklahoma, then we knew that we had to start evaluating this thing minute by minute and figuring out how we were going to test potential patients. As little as a week and a half ago, there was a shortage of tests throughout the United States. So our ability to swab a patient and send that to the state for evaluation was very limited a week and a half ago. So all of that was happening as things started to hit inside of Oklahoma. And when the first couple of cases hit inside of Tulsa County, and we didn't know how fast this was going to progress, Principal Chief Hill declared a state of emergency for the tribe, which gave all of the cabinet the ability to make decisions to keep our citizens safe. And so those cabinet meetings has been happening as things progress. There's been either daily meetings, daily emails, daily phone calls. I'm in constant communication with the principal chief, with the second chief, with the national cabinet, national council, other cabinet members, and if they have an area that they have concerned, me and our task force is able to make those recommendations almost immediately and address it.
That's wonderful to hear. The tribe was actually kind of proactive then.
The tribe has been proactive from day one, and our communication internally with each other and how we're responding to events has been extremely strong. Mm-hmm. So we are closely evaluating it, and we're communicating that effectively across the tribe.
Great. Make sure that we're on those lists.
For sure.
Now, Dr. Beets, I want to ask you a couple of things here. First of all, have we seen any impact at all medically in healthcare because of this virus? We've heard of cases, of course, in Tulsa, and then one in Kellyville, both within the Creek jurisdiction. Has there been any impact or perhaps reaction or any kind of feedback yet?
Well, Gary, we're blessed because we haven't had any confirmed COVID-19 cases within Mvskoke Creek Nation, within our patient population or our community. There's 17 positive cases in the state of Oklahoma covering 8 counties. Most of those counties, if you look at the map, tend to be in the northeast part of the state and centrally around Oklahoma City. As far as impact with the Department of Health, we have had meetings every single day with the task force, and we've also been in contact, of course, with the health administrators and the clinical directors about basically to set up a response. We've looked internally in regards to the services that we provide. Those are ongoing day to day, whether those be acute services, chronic services. We worked very closely with our Cami Willis, who's with emergency management for the Department of Health, and we've done what they call tabletop scenarios at each one of our sites, our clinics and our hospitals, to kind of give people a scenario of what if. If a patient comes in, if 5 patients come in, they end up having COVID-19. We continue to monitor the spread daily in the state of Oklahoma and nationally. I do know that, on the East Coast and the West Coast, where they've been extremely hard hit, their biggest concern, just as Secretary Terry stated, centers around personal protective equipment, masks, etc., not having enough masks. And daily we get updates from the federal government. We're working with Indian Health Service and the CDC, Oklahoma State Department of Health through conference calls and video calls. We have not had the impact that they've seen on the East and West Coast, but we're blessed and we have a little bit more time to get prepared because of where we're located. Mm-hmm.
Something that I'm curious about, obviously, since there's more people in a big urban area as opposed to rural areas, does that really have some effect here in our area?
As far as, can you repeat that?
The spread.
Well, the spread, they did declare actually yesterday finally that we do have community spread in the state of Oklahoma. We had thought we had community spread for the last probably 3 or 4 days, but they needed to determine through their protocols that we do have community spread. Obviously, being in a rural environment, we're not crowded in as they are in Oklahoma City and Tulsa per se. That can diminish the risk simply because you're not around people. But a discussion we've had at the Department of Health is you don't know where that individual's been. Exactly.
Okay, well, I was just curious about, the mass of people. Sure made me glad I lived in Glenpool instead of Tulsa there. Now, as the community reacts to this spread, the coronavirus, the COVID-19 as it's called, have you all heard any feedback from people who were kind of scared or more curious or just wanted more information? What have you heard?
Well, we have. We get lots of phone calls in our facilities, and so we have set up a hotline number that we have posted on our Facebook site, the Department of Health Facebook site, that if you have a concern and you think that you have been exposed, contaminated, or that you're experiencing symptoms, that we would encourage you to call that phone number and we can do a screening right there over the phone.
Now, that's as opposed to going to perhaps your doctor or the emergency room?
That's right, because for the most part, the vast majority of these patients early on in this illness is not experiencing severe symptoms. And so if you're just running a fever and you feel bad, there's really nothing that we can do inside of our physician office except maybe swab you, and it may be a couple of days before we get those test results back. So we can do everything as far as advising you what to do over the phone. And so that's has been the recommendation. We may actually ask you to come to the facility if we need to do something for you, but that initial phone call, it doesn't hurt just to call and say, here's what's going on, and then that way we can also be prepared for you, so that whenever you come in, we can make sure that you're fully protected and our employees are fully protected, and that way we don't spread that where it's not needed to.
Okay.
And I think that, I'll just add something to that. I think that what the Secretary just said cannot be overstated. You know, the biggest concern is, can we handle, as a nation, COVID-19? Yes, we can.
Okay, that was a big question I had.
But if everyone surges to the emergency rooms because it's allergy season now, you know, I'm sneezing, I'm coughing, oh no, I've been exposed. You know, well, if they have the same symptoms every year at this time, and they're not running a fever, they're not having shortness of breath, it's probably allergies. So if you have people surging because of panic into our emergency rooms, then the individuals who are in a car wreck or have had a heart attack or have had a stroke can't be seen, because the emergency rooms are overflowing with individuals because they have panicked. So Dr. Fauci, who's with the CDC, and if you'll see a lot of this on social media, you'll see a lot of this in, you know, just general conversations. There's a curve. We have got to get past that curve, because that's our biggest concern, is that if everybody panics and comes into our emergency rooms, and this is on a national level and local level, then we're going to be overwhelmed and we won't be able to take care of the people who need emergency care.
Now, I think the word everybody needs to be underlined there. Now, when we're talking about resources for our community, we're not just talking about Indian patients.
That's right.
Your department serves our community.
Yes, that's correct.
Okay. Now, the number of closures that have been rippling across the nation has, now, of course, affected us. Going home from work the other day, I passed one fire and the parking lot was empty. On up north to Glenpool, Duck Creek was empty. And I thought, my God, what's good? Then I thought, oh yeah, that's right, we're closing them all down for health purposes. Now, will those kind of closures have any effect on what you gentlemen do?
Well, I think that Gary, this is one of those circumstances that we don't know what we don't know right now. Mm-hmm. I think that all of our focus right now with this virus across the country is that we're trying to stop the spread of this from rapidly happening. So we only know one way of doing that, and that is to eliminate contact.
Right.
So the closing of these facilities is not going to be easy on anyone. The closing of our casinos is going to have a major financial impact on our nation. And the closing of businesses, the closing of schools is going to have a drastic impact on child care and families being able to, what are they going to do to take care of their kids that are home? Everything about this is going to have a major impact. And just like for us, that's probably going to change by the hour or by the day.
Right. So
that's why I think it's important that everyone just come together and be calm and work through these problems, and we're going to get through it.
Have you all any kind of comprehensive list of closures? I notice it's affecting, of course, the businesses, obviously the casinos, and that sort of thing. But has there been any discussions in any meetings that you've had that everything else will be closed? I understand, of course, the tribe at the moment is still open and functioning at full force. But
we are. I don't have a comprehensive list with me right now. I'm sure we can put that once again. What may close, what may be open today may be closed on Monday, and the tribe is evaluating that once again by the hour. The first and foremost thing that we have evaluated are what programs and services it affects our elders. And we know that this is the highest risk population for serious illness with this virus. And so any programs and services that are touching our elders, we're trying to be extremely cautious and mindful of not exposing them if at all possible.
What about the clinics? People depend so heavily on the health care we get through clinics, myself included.
Yeah.
Are you looking at any situations where they might have to close their doors?
We're not going to be closing our doors. We're going to be there for the public. One of the things that we are doing, though, is that we are potentially eliminating routine appointments where the patient needs to come in just for maybe an annual visit or a wellness visit. Those types of things we're probably going to cut back on. Routine dental care, routine eye care, all of those services that you come in where you're not really sick, but that those will start being reduced probably day by day. So we're already starting to implement some of that. We are really looking at our pharmaceutical supplies right now and seeing how that we can get automatic refills turned on inside our pharmacy system so that patients may not even have to call to get a refill, that if we see that it's time for that we can get these refills automatically sent out. And that's another important subject for the patients, especially if you're over the age of 60 and you have a chronic condition, that it's extremely important that you take your medication and try to stay as healthy as possible. So we want you to get those meds. So we have also been discussing with our elderly population if we can also switch some of our medications to 90-day supplies instead of 30-day supplies. So we're evaluating our ability to do that. We initially had looked at trying to do that 90-day supply for everyone, but we don't have the amount of drugs and pharmaceuticals inside our facilities to do that for everyone. So we're going to focus on our elderly patients and try to do that.
Do the vendors have such supplies? They're either on hand or being manufactured?
Well, our vendor, we have one primary vendor that is the Indian Health Service has a warehouse in Ada, and we buy that off a VA contracts. And so the vast majority of our drugs comes through that federal supply that in Ada.
Okay, now Dr. Beets, now I can't emphasize how important it is with your relationship with the communities and our patients there. At this point, is there room for people, I think, with inquiries about, information? Do you have the staff then to respond to people who are just, at this point, I guess, curious and wondering about questions like this? And the second part would be, like, what happens if you're tested positive? Is there a treatment you begin to undergo or drugs, or, where do you go from there?
The first part, Gary, we do have a hotline that has been set up
Great,
within the
yeah.
Department of Health, and we have actually had calls from patients and from members of the community. Of course, we expect the volume of calls to increase, and as the Secretary was stating, as we look at our internal resources, we always have the option or ability to repurpose our staff. They may have been working in one particular area today, but we really need them over here answering the phone because they have the clinical expertise to answer questions.
Mm.
So yes, we do have the staff and we do have the hotline. Patients can always call their clinic. They can be referred to the hotline, and if the individual that answers can't answer their question, we've been working on basically a script, so to speak, which changes daily, of course, and even possibly hourly. We have reassigned one of our Commissioned Corps officers who's a Creek citizen, and I was in contact with her last night. She calls me with cases that are more concerned to her because people will call in with their symptoms, etc. As far as treatment goes, this is a viral illness. There is no cure. I mean, they're working on a vaccination. Latest data is probably late fall, in November, December, they could possibly have a vaccination. There have been some surprising news that's came out from the World Health Organization in regards to possibly treating this malady with some medications that were developed to treat malaria. Hydroxychloroquine is one. They've also looked at some medications that were used to treat Ebola, and they've had some success with that. But there is no definitive treatment at this time, so the biggest thing we can do is public health measures. And the public health measures are social distancing. Don't go out if you don't have to go out. I mean, I understand people have to get out for groceries and things like that, and we're going to be working on our pharmaceutical part as far as mailing for our elders that would meet that criteria, so they don't have to get out to come to the clinics to get their medications. Washing your hands. I was noticing on the Creek Nation site they went Ojing Ogosis, and trying to learn a little bit of Creek, and basically wash your hands. And elbow bump, just common practices. And it'll be interesting actually down the road to see how it has changed our public health in the United States once we get past this crisis.
We have Coco Lowe from the language department coming on next, and maybe she can translate some of that for you. All right. Now, I understand, Secretary Terry, that you have to get to another meeting, so we'll try and wrap this up and get you on your way. Has the tribe look to any extremes that you may have to go close practically everything, shut down the tribe? Have those discussions happened yet?
The discussions have happened. Every cabinet member has been tasked by the principal chief to evaluate their essential staff, how to enact working from home procedures. And so if the situations, if and when those happen, all of our departments have been analyzing all of those extreme measures on how do we continue to keep essential staff in the office, how do we have staff working from home. And so, yes, all of that is being evaluated almost nonstop every day.
Okay. Dr. Beach, let's get that hotline once more, please.
Yes, I can. Do you have a hotline number?
I gotcha. Fine.
I don't have the number, Gary, but you can go to the Mvskoke Creek Nation Department of Health's Facebook site, and there should also be a link on the Mvskoke Creek Nation's website to that, and we post that hotline number out for the public.
All right. Any last thoughts, gentlemen, before we get out of your way and let you get on?
Well, I would like to state that I'm extremely grateful to all of the Department of Health staff who is going to be taking care of the public right now. We have an exceptional group of professionals that's addressing this issue, and the Mvskoke Creek Nation is extremely lucky, I believe, to have the dedicated professionals that is working on this night and day. So I'm very grateful for that. I'm very grateful to the leadership of our tribe, Principal Chief Hill, Second Chief Beaver, and this National Council is always working together and closely with us to put our citizens and our public first and foremost, and I can't be more proud of the leadership to do that. So Gary, I want to thank you for letting us come on and talk about this, and we'll try to keep the public as informed as we can as this thing progresses.
All right. Well, I guarantee you we'll be knocking on your doors for more information. Well, thank you, Secretary Terry and Dr. Beach. We appreciate you being with us this morning. We're going to take a short pause here on Mvskoke Radio, and then we'll be back with talk about Mvskoke language and Immersion Camp with a staff member from there. So please stay with us here on Mvskoke Radio.
I started doing it when I was 11. I wanted to be just like my big brother. And some of my friends were already doing it. We got hooked fast. I just can't get enough. I'm Jacob, and I'm addicted to playing the drums.
There's lots of stuff that makes it cool to be Native. Doing meth isn't one of them. Find something better to do. Check out ncai.org. A message from the Partnership for a Drug-Free America and the National Congress of American Indians.
Who am I? Am I Native? I don't want people assuming things because I'm Indian. I just want to be me. But how do I live in two worlds? Some guys just check out by doing meth. But that ain't for me. Because I see my family, my friends, my drum making, my future. There are a lot of cool things about being who I am. And meth isn't one of them.
Learn more at ncai.org. A message from the Partnership for a Drug-Free America and the National Congress of American Indians.
Welcome back to Mvskoke Radio here on The Brew, 1240 AM, 106.3 FM. And our guest today here in the studio, Kokolo, is practicing her mic drop here. Everyone else is doing it, so I guess she did too. Anyway, Ms. Lowe, thank you so much, Mado, for coming in. And let's see, the gentlemen were asking questions about hand washing. How would you say that in Mvskoke?
Okay. Jingi okosas.
Jinge ogosas. Wash your hands.
Yes.
Okay. The tribe has been having to cancel many of the events and meetings that have been going on around this spring. Right now, we wanted to talk about the Immersion Camp, which is always a joy to talk about. But at this moment, do you know whether or not that will be continuing? Will you go ahead and have your camp this year?
Well, at this moment, we're still taking applications, and we just pray that maybe by June that everything will be over with. But we just have to wait and see what Chief Hill has to say about that.
Right, and this situation is changing hourly, so
yes.
We don't know.
Mm-hmm.
But we do have to take it seriously. Now, also seriously, we have to look at our cultural resources. Now, I've had the privilege of attending language class now for a couple of years, and I'm actually beginning to learn how to say things. And the importance there can't be stressed enough, I don't think. We're still facing a danger of language loss.
Yes, we are. That's why we're trying to have these classes. We were starting a new segment with our beginning language, and we had Mahaya Gracine Hicks that was teaching that. And we had just started on March the 9th, and that was going to run for 6 weeks through April the 15th. We were meeting Monday, Tuesday, and Wednesday from 12 to 1 in our office. And the first 6 weeks was going to be over daily activities, all in the Creek language. Then we were going to start May 4th with our second segment, which would run for 6 weeks. And it was going to be over routines. And of course, you know, just like everything else, it's kind of put on hold. They told us, we set a date as March the 30th that we'd start our classes back up. But, you know, as of right now, we don't know if we will start them back up then or later or what. But we also had our intermediate classes, and Mahaya Rebecca Barnett teaches that, and we were going to start that March the 12th through April the 17th. Thursdays and Fridays was Mahaya Barnett's days, and her first segment was going to be questions and answers, and most of her classes are mostly in Creek. And then the second segment was going to be conversation. She said everybody was going to be speaking in there, and that was going to start May 7th through June the 19th. And so, you know, we're just on hold right now with all of that. But I'd just like to say, Gary, you've done really good in our class. I mean, you've learned a lot. You say a lot more, and we're starting. You know, we just started these classes up, and I think our first day we had like 17 people in our class, in our beginning class, and then it just, the bottom fell out when this coronavirus started up. But we're just going to leave it all in the Lord's hands and see what happens. That's all we can do.
Yeah, ask the questions and we'll get an answer. May not be the one we want, but we'll get an answer.
Right.
Now excuse me. Thank you for the compliment there. I've gained more confidence in using phrases, learning phrases, not being too ashamed if I mess one up. So I almost messed up there too. The approach, I think, to the classes has been really beneficial for me. The academic style, and where you learn adverbs and that's fine for helping build a structure, but not many of us are going to sit around and think about the adjectives and the adverbs that we're going to be using, and whether or not this noun is passive or whatever. We want to be able to speak to each other, and that's been almost a lot of fun, actually, learning to pick up these phrases and try and incorporate them into my daily life. I try and teach my wife, who's Ojibwe, a word or two in the language, and she says it's pretty cool. But you finding it in everyday usage where you need it the most is those questions are being answered for me, at least. So my compliments on the department on its approach. Now,
thank you very much. We appreciate that.
But it's not always easy. You got to get the word out correctly and the right inflection and things like that. So I think the word for duck is one our Mahaya Barnett always used as an example. It's not Fujo, it's Fujo. So if you say Fujo to some Mvskoke, they're not going to know what you're talking about. But I look at things like Casino, Fujo, Creek, and get more comfortable with it. I think that's the biggest word and most important word I can use here in going to these classes. Now, ordinarily, I hate studying and that kind of thing. I always did. But, this is for my own personal satisfaction, and, I'm beginning to see that in this kind of thing. Now, as you design these courses, they're being designed, what is the staff looking at? What are the important things for you to try and communicate?
Well, when they first started the beginning, they went over greetings, how to greet people, like, estoy chimane JD, how can I help you? Or stet hijidajiaza, who do you want to see? And so we've been learning things like that where we can use in the office daily.
Mm-hmm.
And that's really helped a lot. People will come in, knock on the door, and we'll say, Ajiyabas, come on in, Lagabas, have a seat, sit down. And then we go through our routine. JD, how can I help you? And and we do have some elders that come in, and you know, they're kind of shocked because we speak Creek to them. And of course we have some that come in that want to learn, and that's our main point, is keeping the language alive, because every day we lose an elder, they take some of the language with them. So we just want to keep the language alive. Those that are interested, get them involved. And I've taught a few classes myself, beginning at Tulsa Creek Indian Community, and I always told them I'd like for them to pronounce the word, because if I pronounce it for you, you're not going to learn with me saying it. You need to say it, and that way you're going to learn how to say it. And we don't ever tell anybody that when you pronounce a word, you're saying it wrong, because we have so many different dialects that that may be the way that they learned how to say it. And so we're not going to correct anyone and say you're not saying it right. So that's our main focus, is keeping the language alive, teaching as many as we can that are interested in coming. We have some that come almost every day, and then some of them that can't come because something has come up. But we try to put those online. Brandon Barnett is our media specialist, and we try to get him to put it online that afternoon. If they missed that class that day, then they can go online and look at what they missed and be ready for the next day.
Mm-hmm.
So,
well, I guess one sign of progress there is you were using those Mvskoke phrases. I was beginning to pull them apart and understand the individual words. Whereas in the past, it would have just been one long blur to me, and I'm going, wait, what the heck was that? And it went right over my head. But I heard, beginning to recognize the words that were assembled into
put
that
together.
Yeah, so I guess I said, hey, I almost know what she said.
Yeah.
Well, don't ask me to repeat it right now. I think that is a important part of learning. There is kind of getting over the part where you might be a little embarrassed or so because you don't know it. Like my folks were Creek, and my dad was Creek, my mom was Cherokee, so there wasn't a whole lot of language back and forth. And I do remember, some of what my father taught me, and it's coming back as we go. But it was wonderful to be able to say, okay, well, I want this, and if it only benefits me, that's fine. I'm happy. As I say, personal satisfaction, and sharing it with my wife, for fun.
Well, that's good.
Sure, she knows what Ifalusti is, and Bozaji, now it's Bozi Taco, and I can, I guess, vouch for the effectiveness of the program now. I've got one of those jobs that keeps me bouncing in and out from different things. But when I get in there and start reconnecting, it starts coming back.
Mm-hmm.
And think, wait a minute now. I used to know the word for run. Here, let's see, what was that? Which I don't remember at the moment. But
Litkas.
Thank you.
Mm-hmm.
And of course, everyone knows humbugs.
Bucks J, that's everybody. I think that's probably the first word that they learn. And Vegas,
yeah.
Mm-hmm. Or ficunnas, stop.
Yeah, ficunnas. By the way, one thing we might want to do as a public service is let us know if you still got your wild onion dinners going on as planned. We got a few minutes here in the show, so give us a call here at 918-756-3646. If your dinner is still going, please let us know, because all of a sudden we heard Conchardi had decided to cancel, and that was a really good one too. So these are a real public service, and darn it, I was after Tufambachi, but okay. So anyway, that number is 918-756-3646 if you've got some information about your wild Indian dinner. Now, the immersion camp now is it's a technique that I've seen.
Welcome to Mvskoke Radio, your weekly source for tribal and community news, interesting guests and discussions, plus a local events calendar.
The little ones coming in and they're talking shit, and laughing and telling jokes and shit, and gossiping. Even their emails were inserted. But this one's a hands-on camp that usually at state park or something to kind of separate them from
Stone Go, Gary Fife, Geodigifgados, Mvskoke Radio, Mabuhejida Wedskis. Welcome to our program today. If you've been following the news and headlines in Indian country, you know it's been full of the recent developments for the Standing Rock Sioux in North Dakota. The Dakota Access Pipeline has been denied a permit to complete its construction by building pipelines underneath Lake Oahe. It's been hailed as a victory by many of those in the camp and across Native America, but it's also taken with a grain of salt. This agreement could be as good as long as President Obama is in office and could be changed by incoming President Donald Trump. So we'll kind of have to see what happens on that. We know that a lot of folks have vowed to stay if needed, and our hats are definitely off to the thousands of veterans who showed up in support of the water protectors there and gave their support. That particular event is filling our show today. First of all, we'll be speaking with some folks who have been active locally. You might have seen them on television stories conducting demonstrations in downtown Tulsa. And in the second half of our program, we'll be speaking with some Mvskoke Creek gentlemen who have actually been up there and have just returned since these new developments have happened. So we'll get a first-hand idea of what they saw. So please stay with us here on Mvskoke Radio, here on 1240 The Brew. Let's just go ahead and get right into our first piece. We are speaking with Bobby Robidoux, who was an upfront speaker at most of these Tulsa demonstrations, and he was accompanied by Adrian Spotted Horse Chief, and they were talking about the reasons for going up north and why they felt it was important for them to lend their support. All right, now, Mr. Robidoux, you right now, as we speak, are in the process of heading north to join in the water protectors and the Standing Rock Reservation up in North Dakota, correct?
Yes, sir, that is correct.
All right, now,
around 25.
Your
if we could,
name and image has been also shown on some of the
students
demonstration activities here in Oklahoma.
I don't know.
First of all, why do you think it's important for you to be heading north to join in this situation?
Some of them said they can't.
Well, it's important to head north for this situation because there's an unjust act against humanity being taking place. And whenever there's an unjust act against humanity, it's humans' responsibility to come together.
Sitting back with our fingers crossed, waiting to see what's going to happen.
There have been discussions of the reason why this water protectors opposing the Dakota Access Pipeline event has been happening. One, they're saying that the pipeline would desecrate sacred ground, and two, that there is environmental concerns over the water there. Are you following those kinds of reasons? Do you have any thoughts about why these people are taking this stand?
At this point, it's kind
well,
of
yeah, definitely, and it's not that it's a potential to desecrate sacred ground. They have desecrated the sacred ground, and it is an environmental risk. That's why Bismarck the city of Bismarck denied the pipeline to come through their communities, so they rerouted it.
Each year, do you think?
It's
people who are interested in learning the
language. Unfortunate that the mass numbers of a popularized community can ultimately decipher how the layout of a pipeline can be routed to a community that does not have as many numbers. So that's why we are obligated to come in to show that we are numbers.
Learn and listen
and we are worried and concerned about the environmental effects that this pipeline will ultimately have, as the Missouri River is the primary source of drinking water for over 20 million people that feeds into the Mississippi, which leads into the Gulf.
But
now you have been involved in demonstrations down here in Oklahoma. Good deal distance, many miles away from the event in North Dakota.
And of course that would.
First of all, why was it important for these demonstrations to take place here in Tulsa? And I understand there have been similar events in Oklahoma City. Why is it important that Oklahomans down here take part in?
I'm glad to say that.
They're hard-headed.
Be aware of the situation.
Won't give it up. Well, I'm glad that
ultimately
it's there now. The assessment sheets here reflect our loss in elders.
Thing that affects all tribes, not just affecting the Standing Rock Sioux tribe. It also will affect the Pawnee tribes, the Osage, the Creeks, the Cherokees. So, whatever they're willing to do up there, we have to know that it can happen here, and it is happening here in Oklahoma, right? In our Pawnee Nation, we have injection wells, fracking going on, that's violating a lot of our, treaties that were made with the BIA and the Bureau of Land Management. Consideration factors of how that affects our people and our lands are not taken into consideration. So, we have to let Standing Rock know that we are with them. We're just a prayer away. Because ultimately, if we don't unite and come together, then it's just going to continue our segregation amongst each other as tribal people.
These are the tools. This is how it's done.
Before, if something happened to, let's say, the Hopi or the Navajo, we just say, that's their issue.
That's always going to be.
We'll let them handle that all. One united people. So we're standing together. So Tulsa coming together is no different than just being in Standing Rock. This is not a Native American issue. This is a human issue. This is an American issue. It's also a global issue.
You all done
just how power of money and compromise of our government's integrity can ultimately change constitutional rights and views on safety of those affected directly or indirectly by someone else's actions.
Assessment of how many.
During those demonstrations here in Tulsa,
I think I don't know if it was a guesstimate that at one time we might have less than 500, and I don't really know on that. We have 3 Mahayas in our office that are fluent.
Mm-hmm.
And we learn every day that there's some more out there that maybe if they wanted to teach somewhere they would, but a lot of the elders don't want to. They don't want to go to community centers and teach, or maybe they're busy or their health may have something to do with it, or a lot of grandparents are watching their grandkids. They can't get away, and. So it's I think at the tribe at one time we have a language test that you take to get certified, and I'm not positive about this, but I think our manager Judy Montel told me that at one time we had like 55, and at this time we're down to like less than 20.
Oh.
And that's the whole tribe overall.
Well, it's the same situation facing all of our tribes. Now, in the years that I've been coming to class. I've kind of been encouraged by the new faces and the numbers that show up. I know someone will drop out for different reasons, but felt kind of good to see, these people who are expressing this interest. Now, have you seen this kind of growth, and how do you feel when you get these new students coming in?
Well, we just we want to keep them interested, keep them, motivated, and if they didn't want to learn, they wouldn't be there. So we just try to do everything we can to just keep them coming.
Mm-hmm.
We want them to come to every class that they can, and try to we have handouts that we give to them every time they come to class.
Yes, those help.
And that's something they can take back with them and look at and study, and we try to do that at every class that we have.
All right. Well, now we're coming down to last few minutes here in the show, but now the offerings here from your department here are different from the academic kind of things at the college, right?
Right.
And it's not saying anything about anybody and what they're doing. They're both useful, but I would seem to think that the language department is a little more comfortable, less stress on getting it done.
Yeah, I would say that too, because I've went through the whole language course out at the College of the Mvskoke Nation, and I graduated. In fact, I was the first one to graduate out of the Creek class, and Mahaya Marshall was my Mahaya all through the term that I took, and it was very interesting, and I did learn a lot there. And I used to be fluent when I was a little girl, but as I grew up, my parents and grandparents passed away. I had to learn English and just speak English all the time, so I'm trying to get it back now.
Yeah, me too. All right, now let's run over the information regarding the camp, and we'll wrap this up.
Okay, the camp is June the 8th through the 12th at Sequoia Lodge State Park at Hulbert, Oklahoma, grades 7th through 12th grade, and students cannot be 18 years of age prior to June the 7th. Students must include a type 200-word essay on why the Mvskoke language is important. Deadline is Monday, April 13th at 5 o'clock. And you can email me, mlo@mcn-nsn.gov, or if you have any questions, call 918-732-7649 or 918-758-6328. Or you can fax the application to 918-732-7647.
Oh, great. Thank you, Kokolo. We appreciate you coming in and helping us out here. It's always good to talk about the language and the things that are important to us in preserving. They say language is the fabric of culture. And we got a pretty good one here. All right, we're going to take a real short pause here, and we'll be back with a few community announcements. So stay with us here as we wrap up today's Mvskoke Radio.
Who am I?
Okay, great.
Am I Indian? Just because I'm a girl from the res, don't make things up about me. What if I move away? Then who am I? Some kids try meth just to escape, but then I think about my grandma, my little brother, my beadwork, my poetry, and I think, I like who I am, and I know meth is not for me.
Check out ncai.org, a message from the Partnership for a Drug-Free America and the National Congress of American Indians.
Welcome back to Mvskoke Radio. Jenge Okosas, wash your hands there. Okay, real quick, we, as I said earlier, did hear of Conchardi having to cancel their wild onion dinner, but we still have several on the list here. On the 21st, Mary Lee Clark, United Methodist Church in Delta City, also the 21st, Tulsa Indian Methodist in Tulsa. Van Lake Baptist Church, Little Caseta on the 21st, Big Caseta. These are all from a list that I got earlier. You might want to give them a call and find out whether or not they are indeed going to continue with those activities. Boy, this thing happens right in the middle of wild onion season. Okay, what do we got on April 4th? Okmulgee Indian Community Center, food sale, bingo packs. Super Bowl prizes, lots of good stuff there. Call Carl or Barbara, 918-777-6210. Okay, Wild Indian Dinner, we don't know the status of those. While formal wear drive is still going on, Mvskoke Creek students who are interested in receiving formal wear can apply for help there. Give them a call, 918-732-7743. I think that should do it. That's all we can pack in today. Jinge Okosis, wash your hands, and we'll talk to you again next week. Bado. You've been listening to Mvskoke Radio. Join us again next week for more local, tribal, and community news and updates. Mado.